Melissa, the one I want to go back and give Howard something to think on as well as us, and I'm still thinking on it. But in our human factors, Dr. Garzais presented something that I'd never thought about. The more you have to train on a topic, the more defective it is. Now, think about a 2-day respirator training class so somebody can use a respirator correctly. We have a very defective, if I use her terminology, approach to respiratory protection. Now, I never thought about that whole idea is when you have a device or a program that's self-sufficient and takes care of itself, you don't need 2 days of training to take care of that. So maybe in our thought process, we need to go back and not only think about the equipment, but what are all these requirements that we think are appropriate to train when we need to come ways to make them self-evident?
Yeah, good point. Good point, Jim.
I have one comment. I would say that some of that is because I'm thinking of people that have just-in-time programs and had even less than 2 days of training, and you are trying to stand up a program which includes fit testing and training, quote unquote, in a drive-by situation that should have been an established part of a comprehensive safety and health program that was never there or was there in, as a hologram. So I think it's not, so I hate to say the product is defective, but, we talked yesterday about how it's not just the device, it's a program. And I think that the respect for the program and the need for, just in general, the need for safety and health. I'm talking right now in a workplace, but even in a public health square, I mean, part of the problems that we are having is because of the failure to invest in public health infrastructure, national stockpile, all of the things that assisted the wheels in falling off at one time.
So I wrote down my number one issue that I had was the U.S. lack of investment in this area of personal protective equipment. That to me is sort of, and it brings me back to being a member of the Institute of Medicine when we started COPE, and we said to NIOSH, you ought to go into healthcare. We think that should be a focus of yours because you'll get more money to do research on respirators. Well, I think the opportunity there is there if you can expand their capabilities to provide respirators, masks to the public. Because I think for most part, when we talk about respirators under normal circumstances, not COVID, we're talking about a relatively small community of users that need these things. And the rest of the public, I think, figures, well, the employer's going to pay for this stuff. It's okay. I don't have to worry about it. And now you have an opportunity where everyone is being impacted by respirators, facial coverings, and whatnot. And I think it's a unique opportunity to potentially really increase substantially the investment in I would say personal protective equipment, but a chance to do that because I think so much more of the public, and when I say public, I mean government and politics, are going to be invested in this area. They certainly haven't been when we talked about pandemic in the past. But I think it will only enhance NPPTL to become the singular group that you go to for the public for respirators as well as for the occupational.
Thank you, Howard. Ashay had a comment, I think, on the last string of conversation.
Yes, thank you. I wouldn't call it design flaw. I would call it more like I should call it or defect. I should call it more limitation, design limitation. Some of these, and basically, because I don't want to, there is a huge amount of work going on to this, and it is not possible to design the perfect tool or technology, not only for respirators, but anything. There will be a limitation to every type of product. But it is also what what Melissa also mentioned in terms of the overall system. Overall system, we don't think of it as a product. Also, that has also limitations. If we develop a better comprehensive respiratory management program, then definitely that will improve things. So what I mean is, you shouldn't design the worst product or worst labeling and try to say, we can tell them to use, inside of a mask is this. We will tell them blue is inside, or dark blue, light blue is inside of a mask versus outside of a mask. It should be obvious. This shouldn't be, there shouldn't be a need to train that. I have a daughter. I don't want to tell my daughter, you should put this part of the mask on your face. It should be facing you and the other facing us. It should be obvious by design. Things like that. But there will be training definitely needed, but training also needs to be developed systematically to address those limitations so that overall training, instructions, program, and design as an overall system has the best possible outcome.
I think you got a couple of different things here, though. I mean, for the occupational setting, you're talking about training. I think for the public use, it's going to be more messaging. I mean, you're not going to be bringing people. Yes. I think of training, bringing people in, running through this. I would take a little bit of exception to the comment about training, the need to train as being a failure of design, if you will. Respiratory protection is pretty complex in the industrial setting, in the occupational setting, and until you can make people or come up with a way of making people immune to asbestosis or mesothelioma or silicosis or any of the other things that can happen to you from inhaling specific hazards, you're still going to have to train, and you're still going to have to design specific products to protect the worker against that inhalation hazard that you can't engineer out.
Yes.
If they got to work in this environment, they got to have the right protection, and the training is going to be a part of that.
I totally agree. What I meant is just not to, training shouldn't be a way to overcome bad design. That is what I meant. But training can be also badly developed, right? Yeah. There can be good training and bad training. And we have this concept of, are you gonna train them just follow a checklist or step 1, step 2, step 3, or are you going to also tell them why they are doing it, critical thinking? So we call it commander's intent. Are you going to tell them the commander's intent in your training? So that is what I meant. When you are doing the training, you need to also train based on these principles of what a good training is and what it is not.
I think, colleagues, that we should also not forget some of the themes from yesterday. So I want to go to some of the speakers from yesterday. I don't know if Claire is still here. Stephanie, could you please join in?
Sure.
Oh, yay. Hi.
Hi, I'm still here. So I'm thrilled by the past 2 days and feel very optimistic that there's so much consistency in the path forward and impressions, and I'm very encouraged.
Excellent. Mark, did you want to make a comment?
I think my only thought was that I think it was very difficult to create a true approval process for masks that were separately used by the public and not intended for workplace use. It would create sort of another bureaucracy. I'm not saying that's a bad idea, but I just don't think it's a feasible idea. And I think I'd rather see the Defense Production Act used to force companies in the U.S. to make N95 filtering face-to-use respirators because you know that they meet the NIOSH approval protocols. And then, and if you're going to do fit testing on them in the future, with these sort of anthropometric panels, then you have some information about the fit of the respirators, even if you're not fit testing them by use of the general public. So that I think would be sort of the better approach as opposed to creating a new sort of structure for approving public use respirators. That's all.
Thank you for that. Stephanie, please bring back in the concept about needing to think about children as well. You're on mute, hon.
Yeah. I have one of my computer microphones doesn't work properly. So, I also was really encouraged by all the discussion over the last couple of days. I thought some of the comments today, particularly surrounding the need for user-centered design of both the products and communication strategies about them was really important. I certainly agree that, there's still a lot of work ahead of us in terms of educating the public, but also sort of the general medical providers. I know somebody earlier asked about what you learn as a physician, and I'm double boarded, right? I'm boarded in pediatrics and occupational environmental medicine. And certainly in my occupational medicine training, we talked some about respirators. But as I've gotten involved in things the last couple of years, looking at wildfires, I have learned a lot more about respirators than I got in my occupational medicine training. And in my pediatrics training, they were mentioned not at all. So, I think you have to assume that a general provider knows exactly as much about a respirator as the general public.
Yeah. John, do you want to comment on that? You're muted.
I know. I had to find my, my pin. So I totally agree with Stephanie that there's a lot of education of healthcare providers that needs to be done. I've become a frequent media spokesperson with regard to respiratory protection from wildfires in California because there aren't too many other people that can even talk about it. There's so much that we have to teach medical students and residents these days, as you know, to try to find a place for respiratory protection in the curriculum is hard. But I think, again, the COVID-19 pandemic gives us an opportunity to raise awareness about respiratory protection.
For sure. I completely agree. It is an opportunity, right? Crisis and opportunity, the same symbol.
Can I just make one comment and follow up to Stephanie's marvelous presentation yesterday, and just thinking about some of the conversations that happened today, taking sort of the public approach, but also the occupational approach, and thinking of the child within a family as a system who has to get on a school bus with a bus driver to go to school where there's teachers and staff. And when we start to think about the complexity of some of these systems, we need to think about the harmonization of the risk messaging, the harmonization of what we are saying about respiratory protective devices and respiratory protective programs, and advocate for this to be done as quickly as possible, which of course goes to additional funding for NIOSH. But this work is so important, and if we're going to be able to get that message out, we need to make sure it's clear and consistent.
Thanks, Tanir. What about other colleagues who are on the planning committee or other speakers who would like to make a contribution again?
Melissa?
Yes. Go ahead, Jim.
No, let's have Emil go because we haven't heard from him, and then we'll circle back.
Sure.
Okay?
That's great.
Oh dear, I'm not sure that's a good idea. Thank you. Well, I was trying to think about everything we see and what I've tried to indicate in my presentation this morning. Oh, it's actually early afternoon. On everybody pretty much in their homes making their own homemade masks and how to deal with that. And I think, to me, there are, two different topics. One is occupational health and protective devices and PPE and how to address that in multiple challenging, and as the previous two speakers just mentioned, very challenging systems every now and then. But then also the communication to people who are, and very small companies who are almost making these masks in their garage, and how to help them and how it may be providing any type of benefit and what guidelines we should give to them. Because if we would make an ASTM standard on general purpose face masks and the bigger industry would follow that, then they would be pretty much outrun by all the small companies who would just put them out for a few dollars. And if nobody understands what the difference is in terms of the public, general public, the common users don't understand what those differences are, we will not be able to get further than we are right now, which is a free-for-all. And that is a hard problem to solve, but I think it's important to address that. And maybe it's important there to make a distinction between PPE for occupational safety and these general purpose masks for the common public, where the requirements are much looser and more guidelines, but at least a company with some sort of certificate, standard, label, whatever it is and wherever it comes from, would have something that the public health officials then can refer to, saying, okay, this is what you need to buy for this wildfire or for your pesticides or for whatever.
Thank you. Jeff, you haven't said anything before I go back to the volunteers.
Melissa, are you talking to Jeff Stoll?
Yes.
Okay. Well, I'm an advocate of standards, and I think sometimes we forget that standards not only apply to products, and ideally I think that's what we've been talking about mostly, but there can be standards for use and care and creating awareness too. And these are standards that can be used for promoting various groups. If they take hold of these standards, how do you create an awareness program? How do you train individuals? How do you encourage requirements among different non-traditional workers or non-traditional workplaces? So, and even among the general population. So, for example, when we're writing this ASTM standard, we're trying to be very careful about the standard itself dictating very strict draconian type requirements. We explain things in general terms. We have notes. We have explanations so that someone says, oh, yeah, I got to meet this standard. They can pick up and they can learn something about it. And even if a consumer picked it up, they say, oh, I got to meet this standard. What does that mean? There's some educational aspects to that as well. So, we think lots of times, okay, there's the federal regulations and, no one wants to read that. But if we can make our documents and particularly standards more end user friendly, then I think we're in a whole lot better position to make them effective. And by using more nimble organizations in concert with direction from NIOSH and NPPTL and specifically, then I think that further forwards that. And even going back even more, NPPTL already has a capability, for example, of listing products through their PPE info page, as they've done with Ebola and are now trying to do with fentanyl, that some of these products, as they qualify or through some form of conformity assessment, can actually be identified readily by general public and other sources.
I think those are really good specific reflections, and I think they will be very helpful.
Thank you.
Who else, before we go back to the people that have already contributed, anybody else burning down to say something?
Hey, Melissa, this is Maryann.
Yes,
I just wanted to say that for many years, we have been working on a national strategy for respiratory protection across all components, conformity assessment and research, and everything that we've heard over the past 2 days, I believe, aligns with that strategy. And something that's really important is that we have, I believe, the expertise in the conformity assessment area and in particular research areas, but we know we can't do it all. And I think a big part of the path forward involves something that we presented about 8 to 10 years ago now, and that's developing centers of excellence for personal protective equipment and technologies across the country, and leveraging those levels of expertise, perhaps in the areas we heard today, like human factors and behavioral issues, where that we have a few people who work in those areas, but there are some universities who have a larger capacity that can support some of these issues. So I really see a partnership going forward, not just one federal agency, but a great partnership across universities, manufacturers, and identifying ways to enhance domestic production as well. So I think looking at this strategy and starting to execute it now without the funding that we have, with the funding that we have at this time, but I think identifying particular components of it that can be executed without the funding. Thanks. And thank you all so much. This has been very valuable to us.
Very good. I think that's a good idea to move forward, even if you don't have the money to do it. That's, I went to Catholic school, and that's how we did everything, because we never had money for the extra stuff, right? But we still got it done somehow. So anyway, Howard, did you want to say something?
Just two things. One was, somebody will help me out with this, because it's probably the only thing that's confused me in 2 days. There's things I probably don't understand, but it's the only thing that's confused me is what's happening with face coverings and face masks. I sort of had taken the position, in fact, I've given talks on this, that the face mask issue is designed, if it's going to be useful, it's going to be useful to reduce transmission. That it's not a PPE, it's not going to, if you get any benefit at all from protecting you wearing it, great. But it's really a transmission issue. And that's always what I've seen in Asia, where people wear masks when they have colds and whatnot. And I see it as a transmission issue. In the discussion we had here, it sounds like it's everything. It's transmission. It's how does this protect you when you wear it in a wildland fire? In a wildland fire, you don't have to worry about transmission. You have to worry about protection. And so it just completely confused me. What I will say about face masks, Mark Nickus was talking about N95s for the public. And the impression that I've seen in the news is when the truck pulls up to a hospital and they unload boxes after boxes after boxes of respirators. And I mean, most of my life was not working in a healthcare environment. We never had boxes and boxes of respirators. We had elastomeric respirators that were reused. And I think from a public point of view, I can't imagine the public wanting an N95 that you keep throwing out rather than some device that you can wash and bring in the house and wash and reuse it. I don't think they want boxes of N95s if they were available. Now, having said that, there probably is a place for that when the public is actually really exposed and there's a higher risk. But if it's what I do, we wear masks when we walk the dog on our green and stuff. And I have N95s as well, but I wear masks when I do that. So the mask just confused me. If somebody can explain it to me offline, Jim Johnson's always explaining stuff good to me, so he may explain it offline to me. But I just didn't understand the idea of wearing it other than to reduce transmission. And if you get an additional bonus that it actually provides a little bit of protection, that's great.
I think we don't have time to dig into this again, you guys. We have about 5 minutes left. I'm sure people can talk to you offline. I think it is confusing. I think the messaging has been quite confusing and unclear, especially with the rollout of it. You know, originally people were told not to wear a mask, then they were told to wear a mask. And then people are hiding behind the fact that they said that because there weren't enough. Yes, and unrelated, right? So there was a decision change. But I think that what you're saying, Howard, is we have to be careful about how that gets messaged, because both of those areas were part of our purview, both true respirators and masks. And so we have to be careful about how that gets communicated to various populations.